back. Dr. Jacques Spitri of Soho MD, here at the Bullpen at the JP Morgan Health Conference. I'm here with Igor Nasonkin, PhD, with Pythera Therapeutics. Hi, Igor.
Right. Hi. So it's a pleasure to be here, and definitely I'm excited to present our company.
Okay.
It's a startup company. We're 3 years old, a small company with a very strong team and a wonderful drug.
Okay.
That we think it can cure a number of cancers.
Okay.
I'm very excited about this drug, and I have like a long career in cell therapy and gene therapy, and about 25 years, and I basically dropped all that to start this company and commercialize this wonderful drug.
Okay, well, we're going to get into that. Can you, so what's your PhD, and what did you focus on, and how did you transition over?
Well, I got very lucky. I did my PhD at the University of Michigan, so
Okay.
I can say go blue, go blue, they're winning.
Yeah, what a good game.
Right,
Yeah.
absolutely. Wolverines are great, so I can say right away. So I'm a big fan. But 5 wonderful years at the University of Michigan, Ann Arbor, Michigan, human molecular genetics with subspecialty in neuroendocrinology and
Nice.
and stem cells. And after that, I transitioned to doing postdoc in probably #1 place at the Whitehead Institute for Biomedical
Yes.
Research.
Oh, very cool.
Yes, absolutely. And I also did another postdoc at Johns Hopkins, so went through some very good places, including NIH.
Nice.
So I can say NIH, Johns Hopkins, MIT.
So
good
you were deeply in academia. You're all these places.
This is correct. And
yeah.
academia is focused on generating new knowledge, less of like how to treat patients. And my dad is MD, and I was always interested to actually, being somewhere in between, generating knowledge that can actually treat people.
Nice. And so you're in academia. You're doing this research. What led to that transition over to the private sector and to?
Well, I was always looking at the private sector because I was attracted to the idea that that you're doing something that actually helps people rather than generating beautiful like 3D confocal immunohistochemistry data that may give you nice papers, but they may not have direct impact on the lives of people.
So you wanted to do translational work, take what's being discovered in the
That's
lab and bring it down
correct.
to the
I mean,
bedside.
by doing stem cells, I mean, you're kind of doing translational work, but only a very small percentage of what you do in this work gets translated.
Totally.
So when I was a faculty at the University of Pittsburgh, we worked on stem cells and retinal organoids, and we developed some work that we managed to actually patent, and this was of big interest to the company here in the Bay Area called BioTime.
Okay.
And I got connected to a wonderful person with a big name, Mike West,
Okay.
at the time, and founder of Geron, and he worked at Advanced Cell Technologies, and he was the CEO of BioTime at that time. Mike became very interested. We clicked. I came to the Bay Area. He invited my whole team to join. We brought the patent, and that's how it started. The transition was pretty quick, and I never regretted, never looked back.
That's amazing. And so is that what became Pythera, or is this
No,
before? That was before Pythera.
No, so I worked at BioTime for several years,
Okay.
and my final position was director of R&D. So they were doing clinical work. So I learned quite a lot. So it's pretty different from being a faculty. So you actually learn how the products get translated and what it takes. And after that, the asset was sold to Genentech.
Okay.
And after some transition time, I thought that I want to continue this translational work. And at first, my thought was continuing with the stem cell business. But then I was introduced to some really, really interesting work that was done in Central Asia with a thing which is totally different from stem cells, which is a small molecules extracted from botanicals.
Really? Wow.
Yes, striking change from stem cells, from molecular embryology and human molecular genetics to small molecules in cancer. But being human molecular genetics, you do understand how cancer works.
Yeah.
And I have 2 degrees in biochemistry, my master's from Vancouver, so go Canucks, I can say, and my bachelor degree also in biochemistry. So you understand small molecules, and some small molecules are very, very potent. Actually, a majority of chemotherapy drugs came from botanicals. And some of them, such as vincristine,
Yep.
vinblastine, Paclitaxel, XL, they're widely used to manage cancer.
Yep.
What we have and what this botanical has is a whole collection of small molecules viewed as one drug in the eyes of FDA. So FDA has a separate approval path for botanicals.
Wow.
And we don't like when people call them herbs. Herbs are just like what you put in your tea.
Yeah, exactly.
So, but botanical drugs. So we like to say botanical drugs because FDA has a separate approval path for botanical drugs.
Interesting.
This may be done faster, and you can leverage the data in humans and track record of using this particular, say, botanical extract, botanical drug in patients. And that's what we have from Central Asia. This is actually amazing. So everything basically started coming together once I learned how FDA approves those particular type of class of drugs.
So you're able to accelerate your FDA approval process?
That's correct. We're still preclinical, but we're working on that. In our team, we have absolutely amazing people. A former CEO of a subsidiary company where I worked before, Charles, he is in Israel.
Nice.
We have a former COO of a company where I also worked. We have a former director of business development in the company where I worked. So we have amazing people with amazing skills. Each of them bring their own expertise. So look, I'm probably the last one on the list, but the idea of putting it together, of course, was mine. And the idea is focused on commercializing something that has long track record of working in cancer patients. In the other half of my life, I want to do something which is not just beautiful confocal immunohistochemistry images, but something that will have direct impact on people. My actual dream is to develop a drug that will be helping kids. I love kids. I have 2 kids, and every time a kid has a cancer, I kind of cringe. I don't like that. So, and compared to other drugs, where they have one indication, one molecule, which may suppress one type of cancer or partially suppress. We know that cancer cannot be managed with one drug. You have to have the whole combo, 2, 3 or more drugs.
Yes.
And in the combo, every drug gets approved separately. The approval is long. And our drug has multiple molecules viewed as one drug in the eyes of FDA.
Wow.
So that's correct. And one may say, well, hey, botanical, it's something which is not serious. No, it's very serious. As I mentioned before, majority of the small molecule drugs used in oncology come from botanical world.
Yeah.
So you just need to have a second look at this drug because it's very powerful. Back in Central Asia, this drug was given to several hundred people. There is a renowned, well-known physician who lives there, and he works there for years and years and years. He was director of local clinic there, and he was trying to find ways of treating patients with untreatable conditions. Anyway, so he worked out this, came across this botanical, and he's been treating his patients for years and years and years. So I learned about that. We imported this drug. We tested it in our R&D facility here in San Leandro.
Yeah.
Everything checks, and you cannot patent a plant.
Yeah.
So what we did, we enhanced this drug. We
isolated the factors that were.
Well, that's the thing. If you isolate and purify, you cannot be called botanical, and you cannot follow. You cannot leverage that FDA approval path.
Yeah.
Yes, you're not botanical anymore. You're combo.
Yeah.
The beauty with this, we have a whole collection of small molecules, very potent small molecules, but they can be approved with one shot.
Together, is it like an entourage effect?
That's correct. But again,
a
company cannot survive without IP.
Totally.
So again, I'm being helped by some really experienced people, like former chief of business and former CEOs. So they tell me basically, so Igor, you need to do this, you need to that, pay attention to this and that. So of course, IP. We just submitted our first non-provisional, which is big step forward. Right, and the IP is around not the extraction process, but around the composition. So we're adding some extra components to this botanical. We call it Botanical Plus, and it drastically enhances our drug.
Nice.
Right. To test that it actually works, I had to test it on myself.
Oh wow.
Every person who's a scientist, likes trying their own things.
Yeah.
And you go back to like years ago, centuries ago, when people who were studying cholera was just bacteriophages. So drinking those phages to actually prove that it works.
Yeah.
Anyway, so we did that. Everything checks. Everything is safe, at least to the best of our knowledge. And the great thing is that this drug has a long track record of treating many different cancers.
Yeah, so you already had that reference framework to
That's
know
correct.
that it was pretty,
That's correct.
pretty safe.
So so the first clinical trial is usually focused on safety, and we know that the drug will be safe.
Yeah, because of the history.
Yes.
And then in terms of, right now, like, what are you working on for 24? What are you excited about?
Right. Well, right now. So you're asking what are we working on right now?
Yeah, in terms of like, what are you focusing on today? Like, what are your immediate initiatives that you're excited about?
So at the Bullpen.
Just in general for you.
Well, for me, it's basically a first event at this business meeting, which is directly associated with the JPM, and we're a small company. With a great team and a very powerful drug that we still want to be like recognized.
Mm-hmm.
So we want to rub shoulders with the bigger people and tell them, hey, we're here. We have something that you may not have, but you really want.
And you feel like the Bullpen is a good place?
I think so. I think so. And I really give a lot of acknowledgments to Christian.
Yeah.
So he did amazing work as a faculty. I used to organize some of those meetings. I know how difficult it is, and I even had a chat with his dad.
Yeah.
So it was good to know that it's a kind of family business, because you absolutely cannot do it alone.
Yeah, it's a lot of work.
Right. So I'm here to basically say, hey, we're here. So we have something really interesting. Look at us, and I'm here to learn as well, because coming from science, I definitely don't have a business degree, and so I'm learning.
Yeah, and you're doing some amazing work.
Yeah.
So Igor by Therapeutics, thank you for being here today. And if you want to learn more about Igor, his link in bio will be at bullpen.ventures. Thank you, and we'll be back soon.